Okay, let's start with a number that really makes you stop and think. About 1 in 8 women in the U.S. will face an invasive breast cancer diagnosis.
Oh,
That's huge.
it really is. But that statistic, as impactful as it is just one part of a much bigger global picture. And survival looks very different depending on where you live.
Right, and that's what we're digging into today, isn't it? We've got some sources that look beyond just, say, the U.S. guidelines and focus more on the international side of things.
Exactly. Our mission today is to unpack the key facts, look at these really stark global disparities, and understand the big coordinated efforts trying to close that gap, specifically the WHO's Global Breast Cancer Initiative.
And it feels especially relevant now. It's Breast Cancer Awareness Month. And the WHO's theme for 2025, every story is unique, every journey matters, seems to hit this point directly. It's all about fair access to care globally.
Absolutely. It highlights that need for equity. We need to grasp the risks, sure, but also the systems or lack thereof that often dictate outcomes.
So let's start with a scale. What are the global numbers telling us?
Well, the 2022 data paints a pretty serious picture. Globally, you're looking at roughly 2.3 million women diagnosed.
2.3 million, wow. And the mortality.
Around 670,000 deaths worldwide in that year alone.
That's incredibly sobering. And I saw a projection that was, well, frankly terrifying.
Yeah, the projection suggests that if things just continue as they are, we could see both the number of cases and deaths jump by about 40% by 2050.
40% increase. That's millions more lives potentially lost if we don't change course.
It is. But there's also, some good news in the data, or at least a clear path forward.
Okay.
We know what works. Early detection is incredibly powerful. Here in the US, for example, if breast cancer is caught when it's still localized, meaning it hasn't spread, the 5-year survival rate is over 99%.
Over 99%. That's amazing. It shows it's beatable if caught early.
Exactly. That number basically tells us, find it early, treat it promptly. Prevention and quick detection are everything.
Okay, so survival really depends on taking action, and that starts with knowing your personal risk.
Yeah.
What do the sources say are the major factors?
Right. So several things come into play. Age is a big one. The risk generally goes up as women get older. That's pretty well known. Then you have genetic factors like the BRCA1 and BRCA2 gene mutations you hear about, and also just having a family history of breast cancer.
Okay, genetics. What else?
Well, beyond those things you can't change, there are hormonal and reproductive factors. And then crucially, lifestyle choices.
Like what specifically?
Things like alcohol consumption, body weight specifically, obesity, and how much physical activity you get. These are things, daily choices that can add up over time to shift your risk.
It's interesting you mentioned family history, because I think there's a common idea out there
Yeah.
that if you don't have a family history, you're sort of in the clear.
Right. That's a really important myth to bust. The data actually shows most women who are diagnosed don't have any known family history.
So it can really affect anyone.
Absolutely. Which is why screening for everyone, regardless of family history, is just so critical. It's non-negotiable, really.
So let's talk about that screening. What are the main tools?
We basically rely on 3 main approaches for early detection. First, there's monthly self-examination. The idea there is just to get familiar with your own body, what feels normal for you.
Okay, self-exams. What's next?
Second, clinical breast exams. That's when a doctor or nurse checks your breasts during a regular checkup.
Right.
And third, the big one, mammograms.
Mammograms, that's the x-ray screening.
Exactly. They can often find tumors long before you or even a doctor could feel them. And the main guideline in the U.S. from the Preventive Services Task Force, the USPSTF,
Yeah.
is for regular mammograms every 2 years for women between the ages of 40 and 74.
40 to 74 every 2 years. That seems like the bedrock for achieving that 99% survival rate for localized cases we talked about.
It really is. It's the detection infrastructure. But that infrastructure isn't evenly distributed globally, not by a long shot.
And that brings us right to the disparities, doesn't it?
Yeah.
That 99% figure is fantastic, but it masks a huge global divide.
A massive divide. This is really the core problem the WHO is tackling. You have these high-income countries with 5-year survival rates over 90%.
90% plus, okay.
But then you look somewhere like India, and it drops to 66%. Go to South Africa, it plummets down to 40%.
40%.
Yep.
That's less than half, just based on where you live.
Exactly. Your geography is dictating your chances of survival. And it comes down to unequal access to that early detection, timely diagnosis, and then treatment.
Digging into those numbers a bit more, there's something really surprising about the age trends, particularly in India. We usually think of breast cancer hitting women over 40 predominantly.
Right, that's the typical pattern globally. But in several low and middle income countries, and India is a key example, we're seeing a worrying trend reversal. Women under 40 are being impacted more and more.
Under 40. Why is that happening? Is it genetic?
The sources suggest it's largely not genetic, but more linked to, well, lifestyle shifts that come with modernization. Things like delaying marriage, having children later, maybe increased stress levels, changes in diet, less physical activity. All these factors seem to be playing a role in shifting that risk to younger women.
Wow. And there was a story in the materials we looked at that really brought this home, the risk to younger women being underestimated.
Ah, yes. The 22-year-old.
Yeah, tell us about that.
So this young woman, just 22, felt some pain in her breast after a hug. She went to get it checked out.
Okay.
But the initial technician basically told her, the lump looked like an infection, mainly because, and this was the quote, she was too young for it to be cancer.
Too young, based on an assumption.
Exactly. An assumption that delayed things. The first biopsy was abnormal. Thankfully, they did a second one, and that confirmed it was breast cancer.
At 22.
Yeah.
Just out of college, probably.
Right. Not expecting a chemotherapy plan. It's just such a stark reminder that this disease doesn't always follow the rules we expect, especially as global lifestyles change. Age assumptions can be dangerous.
Absolutely.
Yeah.
That delay in diagnosis is precisely what the global strategies are trying to prevent, which leads us nicely into the WHO's plan.
Yes, the WHO Global Breast Cancer Initiative, or GBCI, it was launched in 2021.
And what's the big goal?
It's ambitious, but it needs to be. They aim to cut global breast cancer death rates by 2.5% every year, aiming for 2040.
2.5% per year. What does that translate to in lives saved?
If they hit that target, it could mean saving about 2.5 million lives by 2040.
2.5 million lives, that's obviously huge. But we just heard that projection of a 40% rise in mortality by 2050 if trends continue. Is 2.5% a year enough to counter that? Or is it more about setting a realistic baseline?
That's a fair question. I think it's seen as a realistic, actionable target. It's designed to force improvements in the systems, especially in those lower resource settings where, something like 70% of the deaths actually occur.
Okay, so how are they structuring this? What's the plan?
They've built it around 3 main pillars, and each has a specific, measurable target. They call them the 60-60-80 targets.
60-60-80. Okay, what's the first one?
Pillar 1 is health promotion and early detection. The target here is to get 60% of invasive breast cancers diagnosed when they're still at stage 1 or stage 2.
Stage 1 or 2, that's that localized stage again, linked to the high survival rates.
Precisely. It's about awareness, getting women to recognize symptoms, seek help early, and having services available to actually diagnose them at that early stage.
Okay, so 60% diagnosed early. What's the next 60? That must address the delays, like in the story of the 22-year-old.
Exactly right. Pillar 2 is timely diagnosis, and the target is that patients get their final diagnosis within 60 days of first presenting with symptoms or concerns.
60 days, from first visit to knowing for sure. That sounds crucial, especially if clinics are far apart or overloaded.
It is. It aims to cut down that dangerous waiting period between I found something and here's the plan.
Okay, so 60% early diagnosis within 60 days. What's the 80?
Pillar 3 is comprehensive treatment. The target is for 80% of patients to actually complete the full cancer treatment that's recommended for them.
Ah, so it's not just about starting treatment, but finishing it.
Right, because in many places, treatment breaks down. Maybe due to cost, difficulty traveling for appointments, inconsistent drug supplies. This target pushes for continuity and quality of care right through the end.
So those are the GBCI targets. 60% early stage, 60-day diagnosis, 80% treatment completion. But how do we make that happen on the ground, especially the early detection part in places that can't afford fleets of mammogram machines?
Yeah, that's always been the bottleneck, hasn't it? The cost and infrastructure for traditional screening. But this is where technology, particularly AI, is starting to look really promising.
Artificial intelligence, how does that help?
Well, sources mention systematic reviews looking at AI for breast cancer detection. It's not necessarily about building massive, expensive clinics everywhere anymore.
It's about smarter, maybe smaller tech.
Exactly. Think about things like AI-informed handheld breast ultrasound. There was research on this mentioned from just this year, 2024.
Handheld ultrasound, helped by AI.
Yeah. Imagine a device that's much smaller, much cheaper, portable. A health worker could potentially use it in a remote village, and the AI helps analyze the images, providing reliable, assisted screening right there.
That could be a game changer for hitting that 60% early diagnosis target. in hard-to-reach areas.
It really could. It offers a way to potentially leapfrog some of the traditional infrastructure barriers and bring effective screening closer to the women who need it most. It addresses that access issue head-on.
That sounds incredibly hopeful, actually, using cutting-edge tech to solve fundamental access problems.
It definitely holds a lot of potential for scaling up detection and tackling those late-stage diagnoses that drive the mortality figures.
Okay, so wrapping this up, what's the main message for listeners? What should we take away from this deep dive?
I think the core message is that knowledge needs to lead to action. On an individual level, that means knowing your personal risk factors, age, genetics, lifestyle, and using those detection tools. Self-exams, clinical exams, and getting mammograms as recommended, empower yourself with that information.
Right. Individual action is key.
But connecting it back to the global challenge, we have this looming projection that 40% rise in deaths by 2050. And we have the WHO strategy with these very specific targets, the 60-60-80.
Yeah.
So maybe a final thought to leave everyone with is this. If you had to pick one single lever to pull, one pillar of that WHO strategy, early detection, timely diagnosis, or comprehensive treatment, which one do you think has the absolute greatest potential to bend that curve and fundamentally change that scary 40% projection?
That's a really interesting question to ponder. Which lever makes the biggest difference? And maybe think about what these global goals mean close to the home for policies and access in your own community.